with autism spectrum disorder. That's a lot. Now, it should be said with a little caution there that that survey was a phone-based survey. And there is some speculation that maybe there was a sample bias in that survey and that parents, when asked if they want to participate in a study about autism, if you have a child with autism, you're more likely to want to participate in that study. So, however, it's still a startling number, and the 1 in 88 number is startling, and it should signify that there's a growing need in this area. Now, there's also a lot of controversy surrounding why these numbers are rising so rapidly. A lot of people say it's just better diagnosis. It's clearly more coverage in the media, so parents start to see these signs earlier and talk to their doctors about it. We know that there's more bias amongst healthcare providers in it because we see more research studies done on autism in the medical literature, and so doctors, it's more on the forefront of their mind. And we're just getting a lot better at recognizing these signs. However, regardless of what the reasons are, if it's just better diagnosis, the fact remains that these children are seeking and need services. Agreed? Good. Insurance coverage for children have actually improved. In 1997, 9.9 million children lacked health care insurance. That number dropped to 5.9 million in 2010, and that's despite an extra 4.4 million more children in this country. So we see a lot more health care coverage for children, which means they're able to afford these needed services. So let's think back to our health care list. Convenience, big check mark, right? Agreed? Good. Cost effective, check mark, right? Patient centered. Is it a good idea to have all these healthcare providers under one roof?
Yes.
Is that more patient centered? Definitely. In my research, I found that a really great article this guy wrote where he made the distinction between multidisciplinary and interdisciplinary. Just because you have a bunch of doctors working for you does not make it a team, right? A multidisciplinary team, you might have a social worker, a specialist, a primary care physician, a physical therapist, what have you, but they might not talk to each other at all. And they're just, you come to them and they write what you need and send you out the door. They're not communicating about, well, this doctor just put him on this medicine, that means he's going to have this reaction, and we need to be careful of that. If there's not that communication, it's not really a team. And so multidisciplinary differs from interdisciplinary, where all of these people are tied together and communicating with each other. And when we have all those people under one roof, seeing the same clients, they're definitely talking to each other. Do you think it raises patient satisfaction?
Yes.
Would it make sense? If we believe everything else we've read in the research, it should stand to reason that these patients are more satisfied. So let's talk about music therapy in healthcare and how it affects patient satisfaction. This is really cool. It's one of my favorite studies. Music therapy has been shown to increase patient satisfaction levels in inpatient healthcare settings, hospitals, particularly in cardiac and pediatric units. This is a really cool study from Dr. Yinger at Kentucky and Dr. Stanley at Florida State, where they did a industry standardized patient satisfaction survey of patients at a hospital. And this is something that's used across the healthcare industry. It's not just something they made just for this. And it measures everything about their experience, from the cleanliness of the facility, the friendliness of the staff, the food in the cafeteria. Now, people who receive music therapy services, as well as whatever else they were there for, rated their satisfaction levels higher than those who did not receive music therapy services. And this was a blind study. They didn't know that's what the study was about. They just got a satisfaction survey. The biggest change was seen in cardiac, and the highest levels were achieved in pediatric. Really cool for what we're getting at. So what about outpatient settings? Shouldn't stand to reason if we see this in inpatient settings, we should see it in outpatient settings too. In outpatient settings, we don't see the same results. And I put a big red bummer at the bottom, because when this was your master's thesis, and you spent your master's studies working up to this, and you had this great idea, like, I'm going to show that we can raise satisfaction levels in these clinics, and you get your results back and they look like that, it's kind of a bummer. And so you sit there and write for the rest of the summer saying, well, not much happened. Now, let me back up a little bit. These satisfaction levels were high across the board. I in no way mean to imply that music therapy dragged down satisfaction levels. The music therapy group and the non-music therapy group both rated their satisfaction levels very, very high. We just didn't see music therapy really pull up and beat out those who did not receive music therapy. Let's talk a little bit about it. What I did was I designed a survey. The Press Ganey, which was used in the other one, was not really fit for what I needed, so I designed a survey for inpatient setting that rated everything you possibly want to know about a pediatric clinic. You know, is the staff friendly? Is the clinic clean? Is it well equipped? Is the staff, are the clinicians knowledgeable? Do they communicate with me effectively? Is the price I pay here fair? How likely am I recommend to recommend this to my friends. I rated all of that. Now, as you can see, music therapy didn't really beat anything out, and with the exception of 2 points, which I want to talk about briefly, there was not a big significant difference between the two groups. The significance negatively for music therapy came on the points: clinic therapists effectively communicate goals, treatments, and outcomes with me, and clinic therapists provide me with adequate feedback regarding my child's progress. And if you've been paying attention for the rest of the beginning of my presentation, that should alarm you, and a lot. Because we know that patient knowledge, patient autonomy, and communication are huge indicators of how satisfied patients are and how likely they are to continue using your services. Private practice people, raise your hands again. Don't you want your families who need services, who music therapy benefits, don't you want them to know how effective it is and to keep coming back and to keep using you? That should be hugely important to you. If you work in a hospital, don't you want that funding for your program? And the only way they're going to keep you funded is if they know it's effective. And if we're not communicating that, that's a problem. That could be an entire other presentation, an entire other thesis. And in fact, if you're in a master's program looking for a thesis, I freely grant you the rights to study that, because that should be hugely alarming to us. But we'll move on because I don't want to get too sidetracked. Let's look at a few other points. Positive environment, equipped to serve my child's need, clean and organized. Hey, music therapy beat that. The other group on clean and organized. I'm happy with the progress my child is making at this clinic, and the price I pay for services at this clinic is fair. That's good. Music therapy beat out that. We're adding on a service, but they still think it's a fair price. That's good. As you can see, these numbers are all really high. We're talking on a scale of 1 to 5, and everything, both groups, are above 4.0. Now, here's where we finally get something exciting. Recommend this clinic to others and continue services with this clinic. Music therapy finally wins out on those. And that's really, really cool, especially when we're talking about these are the two big consumer loyalty, consumer behavior indicators. How likely are you to keep using the service, and how likely are you to tell your friends about it? So why do you think it is that we don't see the same results in inpatient and outpatient settings? Anybody have a guess? Somebody's got to have a guess.
What about number of times seen, like over a space of time?
Yes. Why do people go to hospitals? I know we talk about chronic health conditions, but think about if you're taking a trip to the hospital, even if you have a chronic health condition. It's acute a lot of times, right? You had a heart attack. That's a chronic health condition. You're going to deal with that the rest of your life, but it wasn't like you were planning on it. It wasn't like, well, it's time for my heart attack, time to go to the emergency room. Who goes to a pediatric interdisciplinary clinic? Who goes and sees an occupational therapist, a speech-language pathologist, a physical therapist? Chronic, yes, but people who are you there once a month, once a quarter, once a week, right? You get that autism diagnosis, and you're suddenly going to speech-language pathology every week. Now, I've already told you how much competition there is in this market. How many of you, when you hate a service, keep on using it over and over and over again? How many of you cannot wait to get out of your cell phone contract? Cannot wait to be done with Comcast when your Comcast deal is over with? If anyone has family work for Comcast, I don't mean to degradate them, but anyway, why would you continue to use a service that you hated? So, the reason we don't see these same results, I think, is that these people are already very satisfied just by the fact that they continue to come back every week. If you didn't like it, you'd go someplace else. So there wasn't really room to pull it up. Music therapy didn't really have that effect because they were already really satisfied. There's a little bit more bad news. We frequently see the cost effectiveness of music therapy cited as a reason it should be in hospitals, right? We can get patients, NICU babies, out of the NICU sooner and save $2,000 per day. We can do it by 14 days. Another great Stanley study. Great news, right? That's cost beneficial for the patient, the hospital, for the insurance companies. Music therapy for procedural support. We don't have to drug up this child with medicine if we have a music therapist there to help him when he gets his IV changed. That's great for the patient. There's not those side effects. It's a lot more cost effective to hire a music therapist for 15 minutes than it is to pay an anesthesiologist for 15 minutes, and for the pharmaceutical medicines that come with that. We don't really see those cost effectiveness things in the pediatric interdisciplinary clinic setting. Why not? No guesses on this one, huh? Okay. Music therapy is kind of an added service, right? It's great. It's wonderful. But it's typically something we're adding on. If you're coming to a speech-language pathologist saying, you should hire me because I'm going to make it so your clients don't need you as much. Of course, as clinicians, we're always trying to move our clients to a level where they don't need us anymore. That's the end goal, is to provide these clients with as much independence as possible. But if you've worked with autism or with cerebral palsy or anything like that, you know that as soon as one goal is knocked off, there's another one waiting for it. This is usually something that's going to be lifetime for some, or very, very long periods of time. So this is not something like in a hospital where it's like, we're going to get them out 3 days sooner. We're going to end therapy 3 months sooner. This is very long term. So if you come to a speech-language pathologist and say, we're going to replace you, that's not really going to go over well. And it's unethical on our part. Speech-language pathology and occupational therapy is extremely important for these children. I would never, ever, as a clinician, tell them that they should choose music therapy over one of these other things that their doctor's telling them to do. That wouldn't be good for me. I view music therapy as a great way to generalize these skills and help reinforce them and hopefully help them gain those goals faster in a creative way. But I would never say, you don't need your speech-language pathologist anymore, you have me. That wouldn't be ethical. And so those cost-saving benefits, we're extra, we're added on the menu. And that's good, that's not necessarily bad, but you're not really going to convince somebody who owns a clinic that this is going to save them money, or save their clients money necessarily. So how the heck do we sell music therapy to these clinic owners? What's the selling point? I've been telling you nothing but bad news all this time. I feel bad. All right, hang with me. I think I'm going to get some uncomfortable looks on this one. Just bear with me. Let me get to the end. Perhaps the selling point for music therapy isn't increasing patient satisfaction, which is already very high, but maybe it's in offering a unique service that sets them apart from all the other clinics. Perhaps what music therapy offers is a brand. Okay, not too many disgusted looks. All right, that's good. Think back to our brand loyalty, the Apples and the Toyota and the Amazon. There's something memorable about them, right? They stick in your mind. If I said the word MacBook Pro, you probably have a word or image that pops in your mind. So music therapy's biggest liability in this case can also be its most important asset. What do you think music therapy is, or what do you think in music therapy is simultaneously the biggest liability and the biggest asset? No guesses? Somebody's got to guess.
Music.
Music? The word music, the name, right?
Yeah.
How many of you in the last week answered the question, what's music therapy? That's it? You got to be kidding me.
Or like they say, oh, we already have somebody that does that. It's like a volunteer.
I already have somebody that does that. They come in and play the piano, right?
Yeah.
They're always asking what we do. Music therapy is unique. Agreed? The name is unique. What we do is unique. When we walk around with a bunch of instruments tied to our back, in a hospital or in a clinic, that's a little weird. Now, as a liability, unique means low visibility. Not many people know what it is. That's why they ask you, what is that? Nobody asks, what's a doctor? Nobody asks, what's an engineer? Because most people have an idea of what that is. They don't know what music therapy is. Unique as an asset means attention grabbing. There's two very important things that happen, or that we learn every time someone asks us, what's music therapy? What is that? Number one is they don't know what it is, and you can be sad about that. Number two is that they want to know what it is. If someone asks me what I did, and I say, I study the fission reactions in the center of neutron stars, or something like that, they're probably going to go, oh, okay. Change the subject. Why? They don't know what that is. They don't want to know what that is. You're going to go on and on about it. It's going to be really, really boring. But I don't think I've ever had somebody ask me, what do you do? And I say music therapy, and that's the end. They typically always say, what's that? Or, oh, I heard about that. I was with Gabby Giffords, or that was in that movie, or et cetera, et cetera. They want to know more. So that's good. It could be a bad thing. They don't know what it is. They also are really, really interested, and they want to know, and they're going to remember that. So in a sea of pediatric clinics, what if one stood out from all the others? I want you to close your eyes and imagine a scenario here. You just had a child, and you find out it has special needs. Or the child has special needs. Going back to Mr. Ringgold's fantastic presentation this morning. A lot to deal with. Suddenly you got to be looking up all these clinics that your child needs. Maybe you just got that autism diagnosis, and now you got to learn all about autism, and all about speech-language pathology, and all about occupational therapy, and all about physical therapy. And what are you going to do if your child needs these services? So somebody raise your hand and tell me what you think you would do if that happened.
If I knew someone, I would ask for their suggestions or things.
You'd ask for their suggestions? What would be the very first thing you do?
Online.
You'd go online and you would go to what website? Google.com, and you would Google speech-language pathology in Chattanooga.